Rabies is one of the scariest infections on Earth because once clear symptoms begin, survival becomes so rare that medicine almost never gets a second chance. That is why the horror of rabies is not only how it kills, but when it kills, because the best moment to beat it happens before sickness even starts. The title says minute by minute, and that is true in the final phase, but the full story begins with a quiet invasion that can last weeks. Today we are walking through the real timeline from the bite to the silent spread to the terrifying brain symptoms, and finally to why prevention matters most. Quick warning before we begin, this video is educational, not personal medical advice, and any possible rabies exposure needs urgent medical care. Minute 0 begins when saliva from a rabid animal enters the body, usually through a bite, though scratches contaminated with saliva can matter too. Many people imagine the virus exploding through the bloodstream right away, but rabies does something colder and more patient than that. Rabies is a nerve-seeking virus, which means it often stays near the wound first instead of racing everywhere in the first few moments. In the earliest stage, it can replicate in muscle and connective tissue near the bite before it gains access to peripheral nerves. That quiet start is exactly why people can feel normal at first and still be moving toward one of the deadliest infections known. The first 10 to 15 minutes after exposure are incredibly important because washing the wound well can physically remove viral particles. Soap and lots of water for at least 15 minutes is not a folk tip, it is one of the most important emergency actions in the whole disease. Rabies is unusual because a simple act right after exposure can matter more than almost anything doctors do later after symptoms arrive. After the washing step, medical care matters fast because post-exposure vaccination and immune globulin can stop the virus before it reaches the nervous system. That is the race. Medicine tries to build protection before the virus completes its slow trip toward the brain. In the first hours after the bite, the virus is still local or near local, and most people feel nothing beyond the bite itself. There is no special taste, no glowing mark, and no dramatic feeling that tells the person rabies has already started. That silence is part of what makes the disease so sinister because the body can look calm while something dangerous is preparing underneath. Then comes the incubation phase, which usually lasts 1 to 3 months, though the true range can be much wider. Some cases move faster, especially when the bite is severe, heavily contaminated, or close to the head, face, or neck. Other cases take longer, and rare reports describe much longer delays, which is part of why rabies has such a haunting reputation. During incubation, the virus travels inside nerves toward the central nervous system through retrograde axonal transport. That phrase sounds technical, but the simple meaning is this: the virus crawls backward along nerves on its way to the brain and spinal cord. It is not usually moving in a dramatic flood, it is moving in tiny steps, often measured in millimeters per day. That slow movement is terrible for the victim, but it is also the reason prevention can work if started before symptoms appear. For days or weeks, the person may keep living normally, going to school, going to work, and forgetting the danger is still inside the body. Then the first symptom day arrives, and it often begins in a very ordinary-looking way. Fever can appear, headache can appear, fatigue can appear, and the person may just feel vaguely sick or uneasy. Anxiety can rise too, sometimes with a hard-to-explain feeling that something is wrong even before the worst signs show up. One classic clue stands out from the rest: pain, tingling, itching, burning, or electric sensations can return at the old bite site. A wound that seemed healed can suddenly feel alive again in a deeply wrong way because the virus is now interacting with nerves. This is the point where the disease changes from silent threat to active neurologic attack. Over the next several days, rabies reaches and inflames the brain and spinal cord, which means the illness becomes an encephalitis. An encephalitis is inflammation of the brain, and once rabies reaches this stage, the body starts losing control on many levels at once. Restlessness can show up, sleep can break apart, fear can spike, and the person's behavior may become strange or sharply different. The autonomic nervous system also starts to fail, which means heart rate, breathing pattern, temperature control, and salivation can become unstable. This is when the disease becomes unmistakably terrifying because it attacks both the mind and the automatic functions that keep the body steady. The most famous symptom is hydrophobia, but the word can be misunderstood if we think it means a simple fear of water. A person with rabies often wants water and knows they need water, but trying to drink can trigger painful spasms in the throat and diaphragm. Even seeing water, hearing it, or thinking about swallowing can provoke panic and violent swallowing attempts because the nervous system is unstable. That is why hydrophobia is so frightening, The mind understands thirst, but the body turns the act of drinking into agony. Another symptom called aerophobia can happen too, where even a draft of air can trigger distress because the reflex system becomes hyperactive. Minute by minute in this stage, the patient can move between brief lucidity and sudden waves of neurologic chaos. They may drool because swallowing is impaired, flinch at tiny triggers, gasp, choke, or feel trapped inside a body that no longer obeys normally. Observers in earlier centuries described this phase in almost supernatural language because the symptoms look so unnatural and so extreme. Rabies can take two main clinical forms, and that matters because not every case looks exactly like the wild movie version. Furious rabies is the classic dramatic form with agitation, hypersalivation, hydrophobia, and bursts of hyperactivity or terror. Paralytic rabies is quieter and easier to miss, with weakness and paralysis spreading more gradually, and sometimes looking like another neurologic illness. In paralytic rabies, hydrophobia may be less obvious or even absent, which can delay recognition. As the hours and days pass after clear neurologic onset, more severe brain dysfunction starts piling up. Confusion can deepen into delirium, hallucinations can appear, and some patients develop seizures as the brain grows more inflamed. Swallowing becomes harder, secretions build up, and fear often grows because the patient feels every system slipping out of control. Autonomic storms can hit too, with swings in pulse, blood pressure, breathing, and temperature that the body cannot regulate properly. Some patients become wildly agitated, some become weak and paralyzed, and some shift back and forth between those states. That is why rabies is not simply a rage disease, it is catastrophic encephalitis mixed with autonomic failure. Public descriptions often focus only on aggression, but the full reality is much wider and much more medically complex. As the disease advances, muscle weakness worsens, breathing can fail, and consciousness starts to drop. The final path usually leads toward coma, cardiorespiratory arrest, respiratory failure, or total body collapse driven by brain injury. Many patients die within 2 to 10 days after symptoms begin, though some courses last longer and some decline stretches across a few weeks. The main point is brutal and simple. Once the minute-by-minute neurological collapse has started, the odds become overwhelmingly bad. Why is rabies so hard to survive after symptoms begin? Because by then, the virus is already inside the central nervous system. At that point, antibodies and treatments are trying to stop an infection that has already reached the exact tissue it destroys best. Intensive care can support breathing and circulation for a while, but support is not the same thing as reversing the core brain damage. Rare survivors do exist, which is why medicine says almost always fatal rather than absolutely always fatal, but those cases are extraordinary. The famous Milwaukee Protocol created hope for a time after one highly publicized survival, but later experience showed it was not a reliable cure. That is why rabies remains one of medicine's clearest examples of a disease that must be stopped before symptom onset. The emergency starts at exposure, not when the patient becomes afraid of water, confused, or unable to swallow. That lesson can save lives because many people wrongly think treatment begins when sickness becomes obvious, but rabies punishes that delay severely. A bite from a suspicious animal is not a wait-and-see problem, it is a same-day action problem. Wash the wound, seek urgent care, describe the animal, and let professionals decide on vaccination and immune globulin as fast as possible. That sequence is powerful because the long, silent incubation gives prevention a chance that the symptomatic phase almost never gives. The tragedy of rabies is not that humans do not know what to do. The tragedy is that the window for winning closes before the horror becomes visible. By the time hydrophobia, hypersalivation, confusion, or paralysis arrive, the virus has usually already taken the strongest position on the battlefield. That is why even a tiny animal bite should never be ignored if rabies is a possible risk in the area or situation. This is also why public health officials treat rabies with such urgency, because one fast decision after exposure can mean the difference between life and death. So what does rabies do to you minute by minute? It starts quietly in muscle, moves along nerves, attacks the brain, and then tears apart control. It turns swallowing into pain, calm into panic, thought into delirium, and automatic body functions into chaos. And in most symptomatic cases, it ends by shutting down the systems needed for breathing, circulation, and consciousness. One reason the disease feels especially cruel is that the victim can look almost normal during incubation while the virus quietly advances inside nerve tissue. That normal-looking stretch can create false confidence, especially if the bite seemed minor or the wound healed on the skin. But skin healing does not mean the threat is over, because the virus cares about access to nerves, not about how neat the surface looks. The return of strange sensation at the bite site is therefore such an important clue, because it marks the place where the story began. It is the body's warning that the old wound is no longer just a memory, it is connected to an active neurologic process. The hydrophobia stage also explains why rabies became legendary in older times, because people watched thirst and terror happen in the same body at once. A person may desperately need water while their throat goes into violent spasm the moment they try to drink. That contradiction is one of the clearest signs that rabies is not acting like a normal infection, but like a full assault on brain control. The same goes for aerophobia, because a simple draft of air should not feel dangerous, yet a damaged nervous system can turn it into distress. Seen together, these signs reveal why clinicians fear rabies so much, not only for its fatality, but for how completely it disrupts ordinary human function. The disease attacks swallowing, breathing, fear control, movement, awareness, and the automatic systems that normally run quietly in the background. That total breakdown is why the final stage can look so chaotic from one minute to the next. One moment a patient may answer a question, and the next moment they may be choking, panicking, or reacting violently to a simple trigger. That instability does not mean the person is choosing the behavior, it means the brain circuits controlling those reactions are under attack. The contrast between the long silent incubation and the sudden neurologic collapse is what makes rabies feel almost unreal. For weeks, the virus can move in secret, and then within days, the human body can become almost unrecognizable under the strain. That pattern is also why health workers never treat possible exposure casually, even when the wound looks small and the patient feels completely fine. A tiny bite can still matter if saliva reached tissue and the animal was infectious. The body does not measure danger by how dramatic the skin looks, it measures danger by whether the virus gained a path into nerves. That is the part the public most needs to remember. The real emergency begins when exposure happens, not when the dramatic symptoms begin. If action is fast, rabies can often be prevented, but if action waits for proof in the form of illness, the chance is usually gone. That makes rabies different from many other diseases people know because the visible sickness arrives after the best chance to stop it has already begun closing. The timeline is the lesson: silence first, nerve travel next, brain attack later, and almost no room to recover once the last phase starts. Remembering that order can help people treat even small suspicious exposures with the urgency they deserve. That answer is terrifying, but it points to one hopeful truth: rabies is beatable before symptoms if exposure is taken seriously right away. If you want more disease breakdowns explained simply and clearly, subscribe and watch the next video, because understanding the timeline can help prevent the nightmare.